A feeling inside felt very negative. Nothing was in place at all.
He struggled trying to fight what was going on in his head. He kind of looked me in the eye and told me, this function is critical. It's always at the back of my mind. We are pushing the limits of testing multiple functions.
My first guitar was just really for me to start learning. A couple years down the road, I get this one right here for a good Christmas, good surprise for sure. And then this one right here is actually a 7-string Ibanez. I mean, to me, it just makes it, in a sense, heavier, more chugging, more instead of you want to hear more of that. This right here is my little memory wall. So just kind of like, embrace, like first time in the papers when I was playing baseball. I was doing pretty well that year too. And it's just all, my radiation and chemo with this mask, actual mask right here. It reminds me, what I've been through and what, like to keep getting up. I leave it there every day to look at it. It takes a lot to get up and do this every day when you're trying to recover. Music to me means my soul. Every time I'm upset, I listen to music. Every time I'm happy, I listen to music. Angry, sad, depressed, I always turn the radio on regardless. I was in high school. I was playing sports. I had a girlfriend. I had, things I needed to keep getting up and do, pay more attention to, and I couldn't. When I get sick, I get headaches. My mood was off balance. Well, the feeling inside felt very negative. Like a dark ghost was following me around everywhere I went. After high school, I had attempted to leave to Chicago. I started having issues sleeping and had a seizure and decided I had to take care of this. But I'm a crazy.
I met Robert the first time in clinic. Look at your scans. He had a prior surgery for the same tumor, and the diagnosis at the time was a low-grade astrocytoma. He's a young lad here and clearly in some distress, wanting some help. We had a long talk in terms of what needed to be done. My understanding was he really didn't have good experiences from the previous operation. So I had to kind of bridge that with him, make him feel at ease that this is going to be different. It's basically like we call it going through an operation in the brain really can change personalities. They can change the way you think and your objectives in life. But it came across talking to Robert that this was his passion. He wanted to go back to Chicago and play music. I'm kind of thinking through this process and saying, how are we going to do this? There's one colleague of mine from São Paulo, Brazil, who sent me a video of a patient playing the guitar in the operating room. Not necessarily in the type of operating room we were planning to have this operation, but it was doable. So I think I asked him at that first interview, are you willing to play a guitar during the resection? And he looked at me, and I think there was a kind of stunned silence for a couple of seconds.
I was like, can you even do that? Is that, even possible?
This is the second part of the surgery. We're working so hard. Relax your arm as much as you can.
The brain actually has no sensation. The protective layers of the brain, they're innervated by very superficial nerves that we can anesthetize with the same local anesthetics that you get at a dentist office for a root canal or a filling. And when you put that local anesthetic in strategic places around the scalp, it makes for remarkably comfortable surgery. We do awake craniotomies for many years at MD Anderson, nearly once or twice a week. Robert's was the first time we had them use his musical instrument during surgery, yeah.
So in Robert's particular case, the tumor was on the left frontal, part of his temporal lobes, and also part of the insula. I would say a very complex location because it involves multiple regions of the brain. And each of these have a role in language function that also interacts with mood and other aspects of behavior. The temporal lobe has a role to play with memory. frontal lobe has a role to play with the expression of speech. And so the tumor was in a location where he had a number of his mental faculties we potentially could test simultaneously. Once we decided that we were going to go ahead with the awake procedure with the guitar, I was quite nervous because this was a huge enterprise to pull off in the operating room. And we had decided that we are going to use the intraoperative MRI suite, which is an advanced technology operating room. What it adds to the procedure is we are able to monitor the extent of resection while we perform surgery. And that added another level of complexity in terms of planning the procedure.
Surgery in itself is very stressful. And then when you're having to be told that we're going to wake you up, they make Hollywood movies about this kind of stuff, right? It's not a common thing patients experience. And that's one of the biggest challenges to overcome is the expectations around an experience like this. Some patients can't get through this. And so in those cases, we do as best as we can. If they can't tolerate being awake for surgery, then the resection isn't as complete as it would be if the patient was awake. When they're awake, we can do such extensive neurological testing that we can push the boundaries as to where the tumor lies in the brain.
We had more than one dry run with Robert himself. Everyone had to be there to plan this procedure. We actually looked at a lot of detail in terms of where everyone's going to be standing. How are we going to get an instrument the size of his acoustic guitar into the operating room? Because we have to keep it sterile.
What did you see? We can move the camera somewhere there.
Some of the challenges of waking someone up under surgery, a lot of medical issues. They can have a seizure. They can forget where they are as they're waking up from anesthesia. Suddenly want to move and try to get up out of bed or something like that. And so we really have to be really careful as they're waking up from anesthesia to keep them calm.
You're going to give a 10 of Decadron, you can get Keppra.
We know exactly the timings of these medications and how fast the body metabolizes these drugs. And so we can coordinate that time with the surgeon as to when that has to occur.
In Robert's case, we brought him into the operating room. He's asleep and anesthetize the scalp. We go through the initial process, which is opening the skull, exposing the brain. And at that point, we wake up Robert.
All right. You're doing good. You're doing good.
I talk to Robert, so he hears hopefully my comforting voice. We did some preliminary speech testing.
This is
We gave Robert the guitar. I got to say, at this point, I was a little nervous because we don't know how it's all going to play out.
Serenade it, bro. Serenade it.
And sure enough, he played it just as he played it in the clinic. And we determined that we are ready to start the operation. And so he was playing through the operation. And as we are removing the tumor, he continued to play. He had to repeat the same song multiple times, play the same rhythm. So we are comforted that he didn't lose that rhythm during the resection. I was very satisfied with the amount of tumor I was able to remove as a result of what he did. It's like a symphony, right? Things just went so well. Everything fell into place.
Robert did exactly what he was supposed to do, and you can tell from the results. He had a very successful surgery.
Picking up the guitar, it just feels like Thor picking up his hammer. I want to put it in the air and let the lightning strike it. It's just good to see you.
Everyone here with you? Oh, you're
Yeah, got my sister here.
Yeah.
So.
To look at him today, he looks incredibly well, and kind of think of what goes on during these type of surgeries and what can happen, and then to look at the outcome. It's amazing.
The aesthetic of playing creep while having your brain exposed and worked on is truly a vibe I can appreciate. I just appreciate that I was still breathing and playing as well. I've met random people a couple times. They're like, dude, you look so familiar. And I was like, did you see me on YouTube or something like that? He says, why? I was like, because I survived a brain tumor with a guitar. Like, dude, that's you. It's you. Robert seems like such a sweet guy. I'm glad the surgery went well, and I hope his career in music is successful. I hope so too. I'm glad that it did catch as many views because there are very many people out there that are sick with tumors. It's just could be a wake-up call for some, definitely.
I had went for a run that day and it was really hot outside. I grabbed something and my wrists cramped and it just folded inwards and I couldn't control it. I just hit the floor and then within 2 seconds I was unconscious. I woke up and I was in the hospital. We had the MRI. That's when they found the mass on my frontal lobe.
Adrian was told at his local hospital that this was inoperable and it would cause a paralysis of his right side if an operation was attempted.
I was mostly concerned about playing drums because I knew if I survived but I wasn't able to play, I would rather not be here if I knew that I couldn't do the things that I enjoyed.
How did you guys first meet?
Well,
He can look for me.
the seizure that I had was kind of out of nowhere.
Adrian's tumor is in the part of the brain which controls hand function. These tumors are extremely challenging. Every millimeter counts in this part of the brain.
I didn't know that there was such a thing as being awake during a craniotomy.
He clearly was extremely apprehensive.
It just seemed too scary of an idea. There's no way I'm doing a surgery where I'm awake. He showed me a video of a young man that had played guitar. He had talked about his experience and he seemed calm and composed the entire time. He just seemed like he was just laying on his bed, strumming like nothing was going on. As soon as I saw that, it was just like an instant, okay, I'm going through with this. Like it felt like I was at a dentist's office. I just heard Dr. Prabhu behind me. I didn't feel a thing. They had a practice pad in front of me, wanted me to go through some movements to make sure that my fine motor skills were firing the way they were supposed to. I could kind of feel when he was messing with something because my arm would twitch and he kind of calmed me down to let me know this is normal. And yeah, it was just strange to me that it felt so every day. I never would have thought that I was in surgery at that moment.
If we leave tumor behind, it's a negative prognosticator for progression of the tumor as well as survival. The goals are very clear that we want to maximize what we can remove. And so having Adrian awake during the operation really pushed me to achieve more of a complete resection.
What would you say to him if you wait to meet Robert and talk about your experiences?
Robert's video was something that convinced me to do the surgery in the first place. So if I talked to him, I would ask him where he found the strength not knowing what would happen, because I don't know if I would have agreed to the surgery if I hadn't seen his video and his testimony.
What made me want to do it at the end of the day, this was pain in my parents' eyes when I kept saying, no, I don't want to have this surgery. I don't think I should do the surgery. It destroyed me. I stayed here. I'm ready to fight and put my music out.
There's another patient who recently had the same surgery that you had, and he played the drums to do the surgery.
Wow.
If you get a chance to meet him, do you think a jam session is in the equation?
Oh, yeah. But, for sure, definitely, yeah. What's up, man?
Nice to meet you.
Pleasure to see you, man. Wow.
Yeah, excited to play.
Yeah, definitely, wow. Nah, so yeah,
Forgot something.
I messed up a little bit too, but that's all good.
I remember I was in the operating room. I came to meet them.
Oh, Dr. Prabhu, how are you? We just met him, yeah.
I just mixed up your names right here. They were like friends, like they knew each other forever. Welcome all, and good afternoon to everybody. It's a distinct pleasure to have both Robert and Adrian here. It's been a humbling experience for me to see both of you today, and I can tell you they are incredible musicians, so they are ready to kind of rumble. Adrian and Robert.
I've been playing drums since I was 12. I had always been interested in drums. My dad was listening to hard rock when I was growing up, like Nirvana, Soundgarden. That's what I was worried about doing it. If I couldn't play drums, I was going to be devastated.
You both have been an inspiration for me, and I tell everyone, you guys are my rock stars.
Really are making a difference. I'm really grateful that the fact that I can play the way I did before, it means the world to me, so thank you. And everybody that works at the hospital, they've been incredibly helpful and caring.
You guys ready for some more music?
It was amazing. It really was amazing. Both these guys are still who they are, still loving music, still jamming on their drum and the guitar, and it came through their music, their appreciation for the work that MD Anderson was able to provide, the treatment that they were able to provide, and I think that was their way of showing their gratitude towards us.
It's just good to join with another musician and do something great, considering we've both been through, a lot of mess.
It's just a special moment to me just to see his story, to see he's doing well, that we have the same interest in music, and then to play with him. It was an exciting moment for me. I just wanted people to know that their work is appreciated, that they're making a difference.
As an institution, what we can achieve collectively is huge.
Speech and function are what it means to be alive, to have a relationship with your family, your loved ones. Every patient is a Robert to me. Every patient is an Adrian to me. We're going to do the same for every patient that comes through these doors.
Two men were jamming out during a private performance at MD Anderson yesterday.
They actually both had that type of brain surgery that you have while you're awake.
Not only awake, but while playing their beloved musical instrument.
After the news article came out, he texted it to me, and we were just talking about how surreal it was to see ourselves on the news. Ever since the surgery happened, I've been a lot more into drums. I have like a new appreciation for playing.
I went out with one of my friends and I ended up having a seizure. It's just another same kind of scar too, so they don't think. Unfortunately, my hands, this one kind of went off a little bit. Can't play the guitar right now. I'm trying to learn how to replay, I could play this right here, but it's just like trying to strum and this and that. But I'm definitely practicing, trying to get myself back. I just tell myself, if no guitar, I'll just sing,
Made me look at life differently, knowing how fast things can be taken away from me. I don't really live in fear anymore about the tumor. It kind of just makes me look at things positively, to appreciate what I have and the health that I have.
Just stay positive no matter what, regardless, and just keep pushing. There's nothing else we can do just to keep pushing,